Hi there, welcome to the Lad Mix Farm channel. It's Arthur here. Today we would like to look at, as a goat farmer, why you need to have these most important drugs on your farm. First and foremost, it's very important to be readily prepared. Remember, you're dealing with life, animal life, and so with life, animals fall sick. And therefore, it's important that you have a set of drugs that you can really tap into if you are going to be able to save these animals timely. It also helps to cut down costs. Remember, when you don't have these and you get a veterinary doctor to come on site, if they come with their own medication, be sure that you're going to pay highly, because for them they will charge per injection and per animal. But once you have all these, you'll just pay for the service. But also it helps knowing that these veterinary doctors are not so many, first of all, so they are widely spread. And you might need him when he's like 100 kilometers away. But if you've stocked all this drug and you give him a phone call trying to explain the situation on your farm, he can tell you to pick on a particular drug that he guided you to stock and be able to administer to your animal. So once you continue doing this, you end up also learning how to handle some of these cases, especially if you're doing it more frequently. So here we have different kinds of medicines. To start with, we have the antibiotics. For instance, oxytetracycline. But oxytetracycline has two kinds. We have the long-acting and the short-acting. Long-acting in the sense that once you inject an animal with this long-acting, it stays in the body system of the animal longer and is released in the bloodstream slowly as it tries to treat this animal. Then for the short-acting, normally we apply it to animals that have an infection or a situation that is becoming severe very fast. And so you need a drug that is going to act in the system quite quickly to support this animal to recover. So here we have oxytetracycline 10%. And so it's very good. It comes in very fast to try and support the animal. Then the other antibiotic is tylosin. I don't have it here. That's a very good drug, particularly for cough and flu. If your animals have cough and flu, you give them tylosin. Then we also have drip penicillin. This one you apply it when you have challenges in your goat. It could be, they could be having wounds, they could be having swellings, and you want it to come in handy. This is a very good drug to have. And then we have gentamicin. Is a very good drug for your animals. The indications are it's gastrointestinal and respiratory infections caused by gentamicin-sensitive bacteria. We have challenges of diarrhea in animals. For some reason, you wake up or an animal coming from the field and you find it's diarrheating. It could be coccidiosis and so forth. It's good to have sulfadimidine bolus. This is sulfadime. These are actually tablets that you administer to a goat. Normally the bigger goats take like one or so, but the smaller ones, guidance from the vet, we are normally advised to split it like into 4 and administer it, giving each piece per day until the animal, recovers. So we also have Intertrim. Trim is also very good. It's also for gastrointestinal, respiratory, and urinary tract infections. These are some of the infections that they normally indicate. When you want to treat inflammation in your animals, we have dexamethasone. It's a very strong drug to treat things like swellings on the animal. It could be when the animal is having a lot of pain, joints and so forth. Very good drug to have among. Then this one we stock it because sometimes when this is iodine. When we talk to our vet, he says, no, your animal is lacking iron. And so we need to find iron and be able to give this animal. So this one, we have it just in case we need it. And then we have oxytetravet aerosol. This one, very helpful when you're trying to treat wounds, when you're trying to treat, let's say, foot rot and so forth. After you've squeezed out the pus and so forth, is on the swelling, it's important to spray this on the wound. Trying to remove dirt from the wound, you use hydrogen peroxide. This is very good for keeping the wound clean as you try to administer other medicine. Then we have multivitamins. This one helps so much when you want to boost the energy level in your animal. The animal may appear weak when it doesn't have appetite. We normally apply multivitamin. However, multivitamin in most cases is administered together with another drug. In this case, we normally use it together with the oxytetracycline, meaning that once you inject your animal with multivitamin, it will treat the diseases, some of the challenges the goat may be having. But for those that it may not be able to handle, then oxytetracycline comes in to be able to support the animal further. So it's normally given in combination with another drug. And then we have anti-parasitic. We have two types. We have those that are injectable, like ivermectin. This is for treating, for instance, of worms and so forth, but it is administered to the animal through injections. And then we have levamisole hydrochloride. This is Wormicide brand. This is administered orally. Remember, when you're deworming your animals, it's good to always interchange. When you use injectables, let's say after 3 months or 6, you can change and use orals. But also there are cases, for instance, when the animals are pregnant, depending on what your veterinary doctor will tell you. There are certain medications or drugs that you cannot give, for instance, a heavy goat that is about to give birth. So when you have the oral one or when you have the injectable one, he will guide you on which one to pick and treat the animal. I've also brought acaricide. This is basically for spraying. But the most important thing is that all these drugs have active ingredients. So for this Sangatraz, for instance, the brand we are using, it has amitraz as the active ingredient. But once we apply and we spray our goats, say, weekly, for say 5 or 6 months, we'll change and look for another acaricide of a different active ingredient. So as you use all these, you remember you need to have an injection with its own needles. You need to have gloves, very, very key. You need to have a thermometer. Sometimes the doctor will tell you, first get the temperature of that animal and tell me, before he can prescribe or advise you the medication to use if it's not readily available to come on the farm, on your farm. So you can imagine having all this on standby on your farm. It makes it much easier for you to manage situations. You will not go into panic. For instance, if you got a challenge on a Sunday and the vet shops are closed, you are able to tap into this because your vet doctor is always, for instance, a phone call away. This is what we had for you today. Thank you very much. So if you're new to this channel, please consider subscribing so that you can be able to get other subsequent episodes as we journey together. If you're a returning subscriber, please press that notification bell. There you'll be able also to get more videos. But we thank you so much for being part of the Lad Mix Farm family. Please send in your comments and also questions. We shall be able to read them and try to respond where we can so that we move together.